Dr. Manila, and I'm going to talk today about something that's affecting more than 1 billion people in the world, in 1 out of 5 women and 1 out of 4 men. Hypertension. So hypertension, what is it? It's nothing but high blood pressure. So it is what the name says it is. It's when there's a lot of blood against the wall, the pressure of the blood against the walls of the arteries. So essentially your heart is pumping blood to the rest of the body. The left ventricle, the chamber, pumps blood, oxygenated blood, through the arteries to the rest of your body. Now the pressure of this blood against the arterial wall is called hypertension. Now we know we've all heard of 120 by 80 being the normal reading for blood pressure. So what is this 120 and what is this 80? The 120 is called the systolic blood pressure and the 80 is called the diastolic blood pressure. What is a systolic blood pressure? The systolic blood pressure is nothing but the blood against the walls, the pressure of the blood against the walls when the heart is in a contraction. That's 120 millimeters mercury. 80 is the pressure that the blood exerts on the wall of the arteries when it is in a relaxed state, when it's in diastole. So that's why it's a lower number than the systolic. So it's usually 120 by 80, that's normal. So what are the readings that people get and how are they classified? So if you have 120 by 80 or lower, you're low, not too low, but 120 by 80, you're normal. Now it's elevated if you have a systolic blood pressure of between 120 and 129, but a diastolic blood pressure of 80. That's called elevated. Now if you have a systolic blood pressure of 130 to 139 and a diastolic blood pressure of 80 to 89, then you're in stage 1 hypertension. Now stage 2 hypertension is when you have a blood pressure of 140 or 90 or by 90 or greater. So this is the classification of hypertension. Now what are the symptoms of hypertension? Now hypertension is called the silent killer. So it's showing you that a lot of people don't know they have hypertension and they developed end-stage organ damage and heart disease and kidney disease without knowing, because the symptoms are very vague and they don't always present. But if they do present, what are the symptoms? So headaches are a main, it's a significant symptom because it usually happens. Blurred vision. You can have epistaxis, which is nosebleed. You can have difficulty falling asleep or staying asleep. You can have a sense of impending doom or anxiety. And you can have, sometimes you can even have, angina, which is chest pain, if it's come to a stage where it's affected the heart. So these are some of the vague symptoms. Of course, you can have things like nausea and vomiting along with it. So that's why the symptoms aren't very defined. Now, so what happens now? You suspect maybe you have hypertension, or you're going to the doctor for a general checkup, and what is he going to do? To check up your hypertension. So he's going to probably take a couple of readings in that session and make sure he takes it in multiple sessions. So maybe 2 or 3 appointments, and he's going to use that data to tell you if you have hypertension or not. He cannot do it from one reading. So you have to have multiple readings. Why? Because one reading is very, very, it's volatile. Hypertension, when you're reading your BP, it can change with a lot of factors. For example, you can change if you are nervous. There's something called white coat hypertension, where when you are in front of a doctor, your BP goes up. So it changes. It can change if your BP cuff is not big enough or small enough. It can change if you're measuring your BP over your clothes. It can change if you've smoked a cigarette in the last 30 minutes, or if you've exercised in the last 30 minutes. It can change if you have drank alcohol. So there are a lot of factors, and caffeine, and if you have a full bladder. So there are a lot of factors where your blood pressure can vary. And so you need to take multiple readings and make sure that it's high. How do they measure the blood pressure? So when you go to your doctor's office, they will ask you to put out either your right or left hand, and they will put the cuff here because they want to measure the blood pressure in the brachial arteries. They compress that, and they'll put their stent here, and then they listen to the systolic and diastolic readings. Now, it all has to be done at the level of the heart, otherwise your reading will change. So the cuff that they use to measure your blood pressure is also called a BP cuff, but also called a sphygmomanometer, which is a kind of a long word. So we'll just go with cuff, BP cuff. Now, what does a doctor do if he suspects you have hypertension? So now, if you come in with an elevated reading, for example, your systolic blood pressure is in between 120 and 129, but your diastolic is normal, your doctor will tell you to do lifestyle modifications. He will not give you generally medicines. He'll ask you to change your lifestyle, which is live a more active life, exercise, eat a particular diet with low salt. It's called the DASH diet. Do yoga, de-stress, and do all of these lifestyle methods. Now, what if you come with stage 1 hypertension, where your blood pressure is your systolic pressure is between 130 and 139, and your diastolic is between 80 to 89. Now, the doctor has two methods he can go. He usually will check your ASCVD risk. So that ASCVD is a calculator which calculates the risk of your of a chance of heart disease in the next 10 years. So in this calculator, they utilize your cholesterol, if you have diabetes or not, your gender, your race, whether you're a smoker or non-smoker, and a few other criteria. Of course, your blood pressure as well. And so they use this and they can ascertain whether you have a high risk or a low risk. Under 5 is pretty minimal and pretty low, and under 10 is still moderate, but over 20 is when interventions have to be done over 15% or 20%. And your doctor will go into this more. So if he thinks that you have a high risk for getting a heart disease in the next 10 years, he will start you on a medication. And if he doesn't, he might say, hey, go home and continue your lifestyle. Change your lifestyle. Now, what happens if, what happens when you go meet your doctor? So you go and you have hypertension. Your doctor wants to rule out whether your hypertension is primary or secondary. Is it essential or secondary? Now, what are they? Primary or essential hypertension is when there's no organ cause for your hypertension. It's usually idiopathic, and that happens in most people, 90% of people. Secondary hypertension is when there is an organ damage which is causing the hypertension. There's a secondary cause for it. That happens in usually 10% of people. But your doctor does want to rule out that you don't have secondary hypertension, because he doesn't want to miss anything. So he is going to ask you a couple of questions, and he's going to run a couple of specific tests if he suspects this. Now, what is he going to ask you? He's obviously going to ask you, he's going to find out your age, he's going to find out your ethnicity, he's going to find out whether you have a family history of heart disease or hypertension, which is extremely important. He's going to check your BMI and see if you're overweight and if you need to lose weight, so where that stands there. He's going to check your cholesterol levels, and he's going to ask you to bring in your cholesterol levels. He's also going to see if you're diabetic or not, so he's going to check your sugar. He's also going to check your there are other tests to rule out some underlying organ damage, like he's going to do a metabolic panel for your kidney. He's going to check your electrolytes and your creatinine to rule out renal artery stenosis or other kidney disease. He's going to maybe run a thyroid panel and a parathyroid test, calcium, to see if you have any underlying pathology there. He's probably going to look for radiofemoral delay, which is a sign of something called coarctation of the aorta, where the aorta, which is a large vessel which the blood pumps into, the left ventricle pumps blood into that. He's going to check for narrowing of that by radiofemoral delay. So he's going to check a lot of these things. He's also going to see if you have obstructive sleep apnea by doing a sleep study, perhaps, if he thinks you have risk for that. And he's also going to ask you general questions if you've had any major stressors in your life, if you're undergoing a major anxiety, if there's something new that's happened which is stressing you out at work or at home. So these are all very important. So your doctor is going to kind of try to get to know your lifestyle much more, and of course your diet, what kind of foods you're eating, and so that. Now if after all of this is done, what is next? The next thing we have to talk about is treatment. So your doctor will diagnose you with this, and now you need to be treated. So what next? So the first thing you have to do is, of course, as the mantra is, it's lifestyle, lifestyle, lifestyle. That doesn't, ever go away because it's in your hands. So the first thing you have to do is exercise. So, if it's at least 30 to 60 minutes every day, 5 times a week is kind of a must to do. The second thing is you need to remove some habits if you do have them, like smoking and drinking too much alcohol. So the amount of alcohol is usually 2 glasses per day for men and 1 glass per day for women. So that's the maximum amount. So you should not go over that. And even that I do think is a bit too much. He's also going to ask you to follow a particular diet. So a diet which is which is very low in sodium and salt. So there's something called the DASH diet, which is called DASH, which stands for Dietary Approaches to Reduce Hypertension. The DASH diet, which you can research. It's a diet which specializes in reducing hypertension, where you increase your whole grains like quinoa, brown rice, or multigrain bread, for example. You increase your lean meats like poultry, like chicken, like salmon, etc. You increase your non-fat dairies. You reduce your fats. So you're reducing your fats in this diet. And you're also reducing your sodium intake to less than 2.3 grams, and in sometimes less than 1.5 grams of sodium, which is a huge, which hugely helps your hypertension. You're also reducing your sweets and your carbohydrate intakes. And so there are a couple more things that this diet focuses on. Multiple portions of huge portions of fruits and vegetables in your diet as well, to increase other things like magnesium and potassium in your diet. So that's one of the things that you should go research if you do have hypertension. And also, what drugs are we going to use? So that I'm not going to go into too detail, but there are drugs that can be used like beta blockers, calcium channel blockers, thiazide diuretics, ACE inhibitors, ARBs, which is angiotensin receptor blockers, and some other vasodilators. So I think I've gone over a brief understanding into what hypertension is, what are the levels of normal BP, elevated BP, stage 1 and stage 2, what are the symptoms you get when you have hypertension, what the doctor will ask you, what exactly he's looking for to differentiate between primary and secondary hypertension, something with end organ damage and something without, to understand your risk factors, the risk factors that are modifiable and the risk factors that are non-modifiable, like your race and your age and your the ethnicity and your family history. Those are not modifiable, but things that are modifiable are like your diet and your history of smoking or alcohol and things like that. And basically what's going to happen in the doctor's office. Now, I also want to just end with saying that there's something called ambulatory blood pressure monitoring, which you can measure your blood pressure throughout a 24-hour period in the night and in the morning, and probably even while you're exercising. And so you have a more accurate measure of blood pressure. So more people are doing this to see whether they have hypertension, if they can't visit the doctor and get multiple readings, or if the doctor suggests this. And to end with, I want to talk about hypertensive emergency and hypertensive urgency. So if your BP suddenly shoots up to more than 180 by 120, you're in a hypertensive crisis. So you need to go to the hospital immediately. And you either have hypertensive urgency and emergency or emergency. The difference between these two is urgency does not have end organ damage yet, and emergency there is end organ damage. So that's what I want to end with, just so you know the literature. So thank you for listening, and if you have any other questions, please let me know.